Hello, I'm Dr. Jean Jose from the University of Miami Division of Musculoskeletal Radiology. We're going to be reviewing basic MRI anatomy of the wrist. This is intended as an educational tutorial for medical students and junior residents. Let's begin by discussing the tendons of the wrist. Dorsally, we have the dorsal compartments that contain the thumb, abductors, and extensors, as well as the extensors of the fingers. Along the volar aspect, we have our flexor tendons, which are mostly contained within the carpal tunnel. In this useful diagram from musculoskeletal MRI, published by Saunders in 2001, we can nicely see the 6 dorsal compartments and their associated tendons. This is the radius, this is the ulna, this is lateral, this is medial, this is the area of the distal radial ulnar joint. We nicely see dorsally along the distal radius Lister's tubercle, which will be an important landmark which helps us to separate the second and third dorsal extensor compartments. So starting from the lateral margin and extending medially on the dorsal aspect of the wrist, we see the first dorsal compartment, which is made up of the extensor pollicis brevis and the abductor pollicis longus. We then see the second dorsal compartment made up of the extensor carpi radialis brevis and extensor carpi radialis longus. We then have Lister's tubercle. In the third compartment, we have the extensor pollicis longus. Now, the extensor pollicis longus tendon will travel from medial to lateral. As we extend distally from the wrist, it will cross Lister's tubercle as well as the second compartment. Here we have the fourth dorsal compartment, which is made up of the extensor digitorum and extensor indices. The fifth compartment is the extensor digiti minimi, and the sixth compartment is the extensor carpi ulnaris. The extensor carpi ulnaris will play a significant role in the triangular fibrocartilage complex in that its subsheath extends into and forms part of the TFCC. Along the volar aspect, we have the flexor tendons. We also have 2 important nerves. We have the median nerve. We also have the ulnar nerve medially. Within the carpal tunnel, a total of 9 flexor tendons pass. There are the 4 tendons of the flexor digitorum profundus, 4 tendons of the flexor digitorum superficialis, and the tendon of the flexor pollicis longus. The flexor carpi radialis can be considered part of the carpal tunnel, although it is more precise to consider the flexor carpi radialis that it travels in the flexor retinaculum, which covers the carpal tunnel, rather than running in the tunnel itself. The nerve within the carpal tunnel is the median nerve, and it passes between the tendons of the flexor digitorum profundus and flexor digitorum superficialis. So again, this is the radius, this is the ulna, this is the distal radial ulnar joint. We've already discussed the dorsal extensor and abductor tendons. Along the volar aspect, from lateral to medial, we'll see the flexor carpi radialis, the flexor pollicis longus, the flexor digitorum superficialis, and the flexor digitorum profundus. And along the ulnar margin, we'll have the flexor carpi ulnaris. This diagram nicely illustrates the crossing of the extensor pollicis longus over Lister's tubercle and over the second compartment extensor tendons to travel towards the thumb. This point where the extensor pollicis longus crosses over the second compartment tendons can lead to irritation, and it is known as intersection syndrome. Also note that the dorsal compartment tendons are covered by an extensor retinaculum. We see the radial nerve, the superficial branch of the radial nerve that travels along the lateral aspect of the distal radius next to the radial stylar process, and then it will branch towards the thumb and toward the index finger. The radial artery will travel more along the volar lateral aspect, pass deep to the tendons of the first compartment, and then extend dorsolaterally at the level of the first carpometacarpal joint. Notice that the flexor tendons are covered by the transverse carpal ligament, also known as the flexor retinaculum. Also note that the tendon sheath of the flexor tendons extend distally to the level of the distal phalanxes of the thumb as well as the second through fifth digits. Another important muscle that we catch within our field of view of MRI of the wrist is the brachioradialis. The brachioradialis will begin along the lateral aspect of the distal humor and will travel laterally to insert towards the base of the radiostylar process. So these are axial proton density images. This is the radius, this is the ulna, this is the pronator quadratus, and we start seeing our dorsal compartments as well as our flexor tendons. So let's start with the dorsal compartments. Extending distally, we see the first compartment, the second compartment, Lister's tubercle, the third compartment, the fourth compartment, the fifth compartment, and the sixth compartment. The extensor carpi ulnaris will travel at this level within a groove along the distal ulna called the ulnar groove. This structure covering the extensor tendons and the abductor tendons is the extensor retinaculum. Traveling adjacent to the radiostyloid between the first and second dorsal compartments, we see the branches of the superficial radial nerve. And along the volar lateral aspect, we see the radial artery. This is the distal radial ulnar joint, and along our flexor aspect, we have the tendon of the flexor carpi radialis. Here, the flexor carpi radialis will insert into the volar or palmar base of the second metacarpal. It's here, and we'll see it best on our sagittal imaging. Traveling from lateral to medial, we see the flexor pollicis longus, laterally towards the thumb. These are the flexor digitorum superficialis and profundus tendons. Here is the median nerve, and here is that transverse carpal ligament or flexor retinaculum, and the carpal tunnel. More along the ulnar margin, we see the flexor carpi ulnaris. The flexor carpi ulnaris will extend distally to insert into the pisiform, and then via ligaments into the hamate bone via the piezohamate ligament and the fifth metacarpal bone, forming the piezometacarpal ligament. Here we see the ulnar nerve traveling just deep and lateral to the flexor carpi ulnaris, and when we follow the ulnar nerve distally at the level of pisiform, it will travel in a canal known as Guillon's canal with the adjacent ulnar artery. In terms of our osseous anatomy, we have the distal radius, the distal ulna, the distal radial ulnar joint. As we continue more distally, we'll see the scaphoid, the lunate, the triquetral, the pisiform. This is the piezotriquetral articulation. As we extend further still, we'll see the trapezium, the trapezoid, the capitate, and the hamate. This is the hook of the hamate. And then finally, more distally, we'll see the basis of the first, second, third, fourth, and fifth metacarpals. On our coronal images, we'll see the distal radius. This is the radiostylar process. And here we see the brachioradialis inserting along that lateral border of the radiostylar process. On the medial margin, we see the ulnar head and the ulnar stylar process. This is the fovea of the distal ulna. This is the distal radial ulnar joint. We see the scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate, hook of the hamate, and then the bases of the first, second, third, fourth, and fifth metacarpals. This collectively is known as the radiocarpal joint. There are different facets of the distal radius. This is called the scaphoid fossa or scaphoid facet, and this part is called the radioscaphoid joint. This is the lunate facet or lunate fossa, and this is the radial lunate joint. As we previously mentioned, we have the distal radial ulnar joint. The distal radial ulnar joint is also covered by articular cartilage both along the ulnar head margin as well as the distal radial margin. And this indentation along the medial aspect of the distal radius at the articular surface of the distal radial ulnar joint is known as the sigmoid notch. In our sagittal images, we see the radial styloid process. We have the radiocarpal joint. We have the distal radial ulnar joint, and finally the ulnar head with its styloid process. Within the proximal carpal row, this is the scaphoid. This is the STT joint. This is the lunate. Here's the triquetrum and the pisiform, and this is the pisotriquetral joint. And we nicely see the flexor carpi ulnaris inserting primarily within that pisiform and extend distally into the base of the fifth metacarpal. The hamate and the hook of the hamate, the capitate, the trapezoid, and the trapezium, as well as the bases of the first through fifth metacarpals at their corresponding carpometacarpal joints. Now, the one tendon that we do see to advantage on our sagittal images is the flexor carpi radialis that we see traveling and inserting into the base of the second metacarpal here. With regards to the wrist ligaments, we have intrinsic ligaments that attach solely to the carpal bones in the wrist, and we have extrinsic ligaments that have additional attachments to the forearm, retinaculate, or tendon sheaths. The main intrinsic ligaments of the wrist include the scapholunate ligament, the lunotriquetral ligament, and the scaphotrapeziotrapezoid ligament, or STT ligament. Starting off with the scapholunate ligament, it is considered a three-sided box and has three components. There is a volar component, which is the weakest component. There is a dorsal component, which is the most important component for stability of the scapholunate articulation. It is also the thickest component, measuring up to 3 millimeters. And then there is a interosseous component. The dorsal and volar components represent true ligaments, whereas the interosseous component is composed of fibrocartilage. The lunotriquetral ligament also has three components. There's a volar, dorsal, and proximal component. This is a coronal image showing the scapholunate ligament between the scaphoid and the lunate. We feel we see these best on axial images. In this image, we have the scaphoid and the lunate nicely traveling along the dorsal aspect of the scapholunate interval. We see the very thick dorsal component of the interosseous scapholunate ligament. Along the volar aspect, we see the volar component of the interosseous scapholunate ligament. We also see between the lunate and the triquetrum both the dorsal and the volar components of the interosseous lunotriquetral ligament. This is the triquetrum, and this is the pisiform. Moving along with the extrinsic ligaments of the wrist, the volar extrinsic ligaments are composed of the volar radial scaphocapitate ligament, the volar radial triquetral ligament, the volar ulnolunate ligament, the volar ulnotriquetral ligament, the volar radial ulnar ligament, and the ulnocapitate ligament. The volar ulnolunate, volar ulnotriquetral, and volar radial ulnar ligaments we have already discussed with regards to the TFCC. The radioscaphocapitate ligament traveling between the radiostylar process and the capitate joins with the ulnocapitate ligament traveling between the ulna and the capitate to form the arcuate ligament of the wrist. Medial to the radioscaphocapitate, also arising from the volar margin of the radiostylar process, we see the long radiolunate ligament, which is also known as the volar radiotriquetral ligament. More medially, we'll see the short radiolunate ligament, and then we see the ulnolunate and ulnotriquetral ligaments that we previously discussed with the TFCC. Here's a more simpler representation showing the radioscaphocapitate and the ulnocapitate ligament collectively forming the arcuate ligament of the wrist. We also nicely see the radiolunotriquetral ligament, also known as the long radiolunate ligament. Along the far lateral margin, we see the radioscaphoid ligament, which is labeled RS. Along the more distal aspect of the arcuate ligament, we also see a ligament extending along the volar aspect of the scaphoid into the triquetrum, known as the volar scaphotriquetral ligament. So the volar radioscaphocapitate ligament attaches to the radiostyloid. Fractures of the radiostyloid process or osteotomies may affect the volar radioscaphocapitate ligament and may lead to instability. The volar radiolunate ligament, again, is called by many different names, including the radiolunotriquetral or long radiolunate ligament. It also originates from the radiostylar process, and it will travel from the distal radius to the lunate, ending in the triquetrum. This is the scaphoid, this is the lunate, this is the triquetrum, this is the radius, this is the capitate. So here are nice representations of a coronal MR showing the radioscaphocapitate ligament as well as the long radiolunate ligament, also known as the volar radiolunotriquetral ligament. Here we will see this ligament going from the radiostylar process towards the capitate. This is the radioscaphocapitate ligament. We will then also see a ligament traveling from the ulna towards the capitate. This is the ulnocapitate ligament, collectively forming the arcuate ligament. More medially, traveling between the volar aspect of the radiostylar process and extending to the lunate and the triquetrum is the radiolunotriquetral ligament, also known as the long radiolunate ligament. And then far more medially, we see these fibers, which are the short radiolunate ligament. To review, so on coronal images, when we examine the volar margin of the wrist, we shall see 6 main ligaments. We have the radioscaphocapitate ligament, the radiolunotriquetral ligament, also known as the long radiolunate ligament. More medially, we may see the radioscapholunate ligament, which is an important ligament as it functions as a neurovascular conduit for the interosseous scapholunate ligament. We will also see the ulnolunate ligament, the volar ulnotriquetral ligament, and then the ulnar carpal ligament that will travel in this direction. Deep to the ulnar carpal ligament, we will see the proximal and distal bands of the volar scaphotriquetral ligament. Between the radioscapholunate ligament and the ulnolunate ligament, we may see a ligament extending from the medial volar aspect of the radius into the lunate and this is known as the short radiolunate ligament. Finally, along the far volar margin, we may catch portions of the volar distal radioulnar ligament. So as we scroll through, so on our coronal images, we again see the radioscaphocapitate ligament, the radiolunotrachretrial ligament. This is the area of the interosseous ligament, and these fibers here form the radioscapholunate ligament, traveling in this direction and abutting the interosseous ligament. More medially, this ligament extending from the medial aspect of the volar distal radius and traveling into the volar margin of the lunate. This is the short radiolunate ligament. Along the medial margin of the distal radius, we shall see a ligament extending from the radius and into the ulna, and this is the volar distal radioulnar ligament. We shall also see a ligament traveling between the ulna and the lunate. This is the ulnolunate ligament, and a ligament traveling between the ulna and the trachretrium. This is the volar ulnotrachretrial ligament. On the axial and the sagittal images, these ligaments will blend in together to form this black structure. We'll see that the short radiolunate ligament is in close proximity with the volar fibers of the scapholunate ligament. And on the sagittal images, again, we see, depending on what level we are, we can nicely blend in and see the individual ligaments which will form this black structure. The dorsal extrinsic ligaments include the dorsal intercarpal ligament, as well as the dorsal radiotrachretrial ligament and the dorsal distal radioulnar ligament. We discussed the dorsal distal radioulnar ligament when we covered the TFCC. So let's concentrate on the other two. So along the dorsal medial aspect of the distal radius, we will find a ligament traveling from the radius to the trachretrium, which is known as the dorsal radiotrachretrial ligament. We will also see a ligament traveling from the dorsal aspect of the trachretrium towards the scaphoid as well as the trapezium and trapezoid. This is known as the dorsal intercarpal ligament collectively. There are three different bands of the dorsal intercarpal ligament. There is a scaphotrachretrial ligament, a trapeziotrachretrial ligament, and a trapeziotrachretrial ligament. So the three main dorsal extrinsic ligaments have great functional significance. Include the dorsal intercarpal, the dorsal radiotrachretrial, and the dorsal radioulnar ligaments. So again, this is a simpler schematic showing the dorsal intercarpal ligament extending from the dorsal aspect of the trachretrium to the scaphoid and also throwing bands to the trapezium and trapezoid, and the dorsal radiotrachretrial ligament here. And here's the MR imaging showing that. So again, traveling from the dorsal aspect of the distal radius, we see the dorsal radiotrachretrial, and then traveling from the trachretrium towards the scaphoid, the trapezium, and the trapezoid, we see the dorsal intercarpal ligament. Let's review more carefully the dorsal ligaments. Dorsally, we will catch along the lateral border the radiocollateral ligament extending from the radial styloid into the distal pole of the scaphoid. We will also see the dorsal scaphotrachretrial ligament traveling here. This is known as the dorsal intercarpal ligament. We will see the dorsal radiotrachretrial ligament, the dorsal ulnotrachretrial ligament, and then along the far dorsal margin of the distal radioulnar joint, we'll see the dorsal distal radioulnar ligament. So here on this coronal MRI, we see the radiocollateral ligament extending from the radiostyloid into the scaphoid. And more dorsally, we see the dorsal fibers of the distal radial ulnar ligament, the dorsal radial triquetral ligament, and the dorsal intercarpal ligament, specifically the dorsal scaphotriquetral ligament. Here we see the dorsal radial triquetral ligament here. We see the dorsal intercarpal ligament, and these fibers are the dorsal scaphotriquetral ligament. We see the distal dorsal radial ulnar ligament here. And finally, we see fibers of the dorsal ulnar triquetral ligament. On our axial images, we have to be mindful at what level we're examining. More proximally, we'll be at the level of the distal radial ulnar joint, the radius, and the ulnar head. And here we'll see the dorsal radial triquetral ligament. As we extend more distally, we catch portions of the scaphoid, the lunary triquetrum. We'll see portions of the dorsal radial triquetral ligament that have now attached into the triquetrum. We will also see portions of the dorsal ulnar triquetral ligament at the level of the ulnar head and of the dorsal margin of the triquetrum, proximally. As we extend more distally, we will see a broad band of tissue extending from the scaphoid into the triquetrum, and this is the dorsal scaphotriquetral ligament. So when we see in our images, here we're at the level of the distal radius. Our dorsal radial triquetral ligament will travel in this area here. Our dorsal ulnar triquetral ligament will travel in this area here. As we extend more distally to the area of the scaphoid, we see our dorsal scaphotriquetral ligament, also known as the dorsal intercarpal ligament. So again, here at the level of the scaphoid and capitate, we see that dorsal scaphotriquetral ligament extending into the triquetrum. We also see some portions of the volar scaphotriquetral ligament. Along the volar margin, extending from the volar medial aspect of the radius, we'll see the radioscaphocapitate ligament that will then extend toward the scaphoid and into the capitate. We will see the ulnolunate ligament that arises from the volar margin of the ulnar head close to the volar distal radial ulnar ligament and extend into the lunate and finally along the lateral margin of the radius extending into the scaphoid, we will see the radiocollateral ligament. More distally, we will be able to follow the radial lunar triquetral ligament, which extends from the radius to the lunate and triquetrum. We will see the volar ulnar triquetral ligament, which begins more medially along the ulnar head, extends into the triquetrum, and then more distally we will catch the scaphotriquetral ligament, the volar scaphotriquetral ligament. So here we are. This is the radial lunar triquetral ligament. It's extending towards the triquetrum. We see the dorsal radial triquetral ligament as we previously described. More distally, we'll see the dorsal scaphotriquetral ligament and the volar scaphotriquetral ligament at the level of the capitate. We see the radio scaphocapitate ligament. We also see the radio luno triquetral ligament Medially, if we follow the volar fibers of the volar distal radial ulnar ligament, we will see a ligament that attaches here to the lunate. This is the volar ulnar lunate ligament. More medially, as we extend distally, we have a ligament that forms the ulnotracheal ligament here, attaching here. And then finally, as we extend more distally, we see the volar scaphotracheal ligament. To review on coronal images, traveling between the dorsal aspect of the distal radius towards the tracheatrium. So this is the dorsal radiotracheal ligament. We also see this ligament traveling between the scaphoid and the tracheatrium, as well as having smaller bands to the trapezoid and trapezium, and this is known as the dorsal intercarpal ligament. On our sagittal images, as we go from lateral to medial, along the volar margin, we'll catch portions of the radioscaphocapitate ligament that extends into the capitate. So here is the radioscaphocapitate. We also see portions of the radial lunar tracheatrium more inferiorly. When we go more medially, at the level of the ulna, we shall see extending from the volar aspect of the volar radial ulnar ligament here, and we see the ulno-lunate ligament here. This is the dorsal radial ulnar ligament and the dorsal ulnotracheal ligament. When we reach the level of the articular disc, we'll see the volar ulnotracheal ligament extending from the ulna to the tracheatrium. And here is the dorsal ulnotracheal ligament. So on our sagittal images, this is the area of the radioscaphocapitate. This is the area of the radial lunar tracheatrium ligament. This ligament extending from the volar aspect of the radius and into the lunate. This is the short radial lunate ligament. At the level of the scapholunate interval, we shall see another ligament here. This is the radioscapholunate ligament. And then finally, along the far medial margin, we'll see the volar ulnar tracheatrial ligament and the dorsal ulnar tracheatrial ligaments here. Dorsally, as we go from lateral to medial, we'll see the dorsal radial tracheatrial ligament extending from the dorsal aspect of the radius and the dorsal scaphotracheal ligament along the dorsal aspect of the scaphoid. They will continue medially to insert into the dorsal aspect of the tracheatrium. The dorsal radiotracheal ligament will insert more proximally, and the dorsal scaphotracheal ligament will insert more distally. We will also see the dorsal ulnotracheal ligament. So here are examples of the dorsal ulnotracheal ligament here. The dorsal radiotracheal ligament will be here. The dorsal scaphotracheal ligament will be here. As we extend medially, we'll see that the dorsal radiotracheal ligament will insert here, while the dorsal scaphotracheal ligament will insert here, and these are the fibers of the dorsal ulnotracheal ligament. Consistently within our field of view of the wrist, we will see the superficial anterior oblique ligament, the deep anterior oblique ligament, and the dorsal radial ligament. So this is the abductor pollicis longus tendon that inserts into the dorsal lateral base of that first metacarpal. If we reflect that, we should see portions of the dorsal radial ligament of the first carpometacarpal joint. So this is a sagittal MR arthrogram imaging showing this ligament extending from the trapezium into the base of the first metacarpal, and this is known as the dorsal radial ligament of the first carpometacarpal joint. Along the medial margin, we shall see the superficial and deep anterior oblique ligaments of the first carpometacarpal joint. So here again we see nicely the deep and superficial components. We catch the dorsal radial ligament as well as the anterior oblique ligaments here.